Hello students, welcome back to my channel. In this video, I'm going to teach you how to effectively interpret ABG values and how you can solve questions on acid-base balance. This is one of the topics that a lot of students fear the most. They get confused anytime they get a question where they have been given pH values, partial pressure of carbon dioxide to interpret. Their brain just get frozen. By the time you are done with this video, I promise you one thing: you will never get confused again anytime you get this kind of questions ever again. This is the last video or the last teaching you're going to have on acid-base imbalance, and that ends it. Now, let's begin with some basic introduction. So, you know that the body is always in a state of trying to maintain balance, okay, for optimal function of the cells. So there's a term called homeostasis, okay, which is used to describe how the body is always maintaining balance. Now, that state of balance can happen in fluid, okay, maintaining fluid balance in the body between intracellular and extracellular compartments, maintaining electrolyte balance. And another area that the body always is concerned about maintaining balance or ensuring homeostasis is acid-base area. Now, the body is such that it is always trying to maintain that balance between two important ions. And those two ions are the hydrogen ion, okay, the hydrogen ion, that is the H plus ion. Now, this ion, which the body is trying to maintain balance with another one called the bicarbonate ion. So the H ion is H plus, and then this one is minus. So the H plus is acid. It represents the acid, and this represents the base. All right. So the body is always in a state of maintaining balance to keep them in the proportion they are supposed to be in. And that is very important for functioning of the cells of the body. Now, there are two major types of acid in the body. We have the volatile acid. All right. The volatile acids are those acids that are eliminated from the body as gas. Okay, as gas. So I'm laying this foundation for you to get to understand something. So the volatile acid in the body is called carbonic acid. Carbonic acid, and it is H2CO3. That is um the what's the name? The chemical formula. So the carbonic acid is the only volatile acid produced in the body. Now, how does carbonic acid come about? It comes about when carbon dioxide combines with water. Then that leads to H2CO3. All right. So carbon dioxide combining plus water leads to H2CO3, which is a carbonic acid. Now, it's a weak acid. It can come back, okay, it can get back, can dissociate back into the carbon dioxide and the water. So you see that when we breathe out carbon dioxide, and there's also water component. Okay, so basically this acid, which is called the carbonic acid, is eliminated through the respiratory um, system of the body. The lung takes care of it. So we take in oxygen. After it's taken through the body for it to work, carbon dioxide is brought back to the lung for it to get out of the lung. Now, when this carbon dioxide stays in the body for a while and is not coming out, it can combine with water and it will form the carbonic acid. What this means is that carbon dioxide is an acid, or it is a potential acid. So the more you have it in the body, the more you will form acid and the body becomes full of acid. Okay. Now, there are other acids in the body. So that's about the volatile. There are other types of acid that are the non-volatile acids. These ones are not eliminated by the respiratory system. Okay. They are also in the body, all right. And they must be metabolized or excreted from the body in fluids. Okay. So example of those ones are lactic acid. Okay. Lactic acid, hydrochloric or HCl. Then we have the sulfuric acid. Okay. And then we have the phosphoric acid. Now, these ones are non-volatile. They don't get out of the body through gas. It is only the carbonic acid that is volatile and gets out of the body as a gas. But these ones, so you have heard of lactic acid before. Um, when we are exercising, it can get accumulated in the muscles. Hydrochloric acid, you all know that it is in our stomach. It aids digestion. Okay, so these are non-volatile acids. Okay, now let's go on. There are two systems based on this. Let me introduce you to the two major systems that regulate acid base in the body. They are the respiratory system and the renal system. So, as I was saying, the volatile acid is taken care of by the respiratory system. Now, for the non-volatile acids, the renal system produces bicarbonate that is responsible for regulating the non-volatile acid in the body. Okay, there are other systems like the buffer system that also regulate, but that's not the purpose of this lecture. So this is the foundational knowledge I want you to have. We are talking about regulation of acid base, and we are talking about regulation between H ions and bicarbonate ions, and I talk about volatile and non-volatile acid. And I've also told you the two major systems that are responsible for maintaining acid base balance in the body. Now, let's now get to the details of why we are having this meeting. Or now, like I said earlier, one of the topics many students often fear is the acid base balance and ABG interpretation. So let's go to the ABGs. Now, ABG is a test that is done to ascertain um, acid base balance and also gaseous exchange in the body. So I'm going to talk about very important values here, which are the components of the ABG. And for interpretation of acid base, we are interested in a major first three of it. So the first one is the pH. The second one is the partial pressure of carbon dioxide. Then the other one is the bicarbonate. Now let's look at the normal values of this component. For the pH, it is 7.35 to 7.45. That is the normal value for the pH. Then for the partial pressure of carbon dioxide, the normal value is 35 to 45 millimeter of mercury because it is a gas. So it is measured in terms of pressure. So it's measured in partial pressure. So it's 35 to 45 millimeter of mercury. For the bicarbonate, the normal value is 22 to 26 milli equivalent per liter. Now, do not forget these values. Do not forget them because they are needed to do the interpretation. So let's start with the big idea. What really goes on? The big idea. So for the pH, let's talk about the pH. We already said that the value is what? 7.35 to 7.45. Okay. Now, here's the thing. If you are given a value of the pH that is below 7.35, it means what? You are dealing with acidosis. You are dealing with a condition or a disorder called acidosis. If it is above 7.45, you are dealing with a condition called alkalosis. Now, in the beginning of the lecture, I told you that we are racing between H ion and HCO₃ ion. All right. Now, when a person has so much acid in the body, which is the H ion, the disorder is called acidosis. Acidosis. And if we have too much base, the HCO₃ is a base. So if you have too much, so if this one is high, what you have is alkalosis. You have a condition called alkalosis. And if a person has the H ions too much, the condition is called acidosis. Okay. Now, this is represented by the pH if the value is below 7.35, and the alkalosis is represented when the value is above, okay, 7.45. So below this is acidosis, then above this is alkalosis. Don't forget this because it's crucial as we move on. Now, what happens when the value is between the 7.35 to the 7.45? This is normal. Okay, the pH is normal. But the patient may still have something going on we call compensation, but we'll come to that later. So I hope you've understood up to this point where we say if the value is below 7.35, we have acidosis, and if it's above 7.45, we have alkalosis going on. That is very good. So once you get this into your mind, I want to give you the first step in interpreting ABG values. So the first step, step one, the step one is to interpret the pH. So the pH value that they've given you or the question has given you, you must first interpret it. And how do you do that? Ask yourself whether the value is normal. Is it within the normal range? That is it here? Is the value anything between this? If it is this, it's normal. If it is below, as I told you earlier, this, then you should interpret it as acidosis. Simple. If it is above this, you should interpret it as alkalosis. Okay. So what is your interpretation? It's either its normal value, or two, it signifies acidosis, in which case it is less than 7.35, or the next thing that you can interpret is alkalosis. It's as simple as that. In which case the value will be greater than 7.45. Now, if you are done with this, you have crossed the first hurdle. So, for example, if the question gives you that the pH of the patient is 7.20, what will be your interpretation? You ask yourself, is this below 7.35 or is above 7.45? This is obviously below 7.35. And that means that we have what case at hand? Acidosis. Correct. I know you've gotten it. We have acidosis at hand. Okay, that's good. Now, if they give you, assuming they give you another value, let's say pH of the patient is equal to 7.50, you have to interpret this. So ask yourself, is it below 7.35? Is it normal or is above 7.45? Obviously, this is what? Above 7.45. Therefore, this means that we have that this patient will have a condition called alkalosis. So that's the first step. The first step is what? Interpret the pH and give it a meaning. What does it mean? Are you dealing with alkalosis? Are you dealing with acidosis? Or is it a normal value? So, for example, if you are given pH of, let's say, 7.40, what does this mean? It is a normal pH. It is that simple. That's what? The first step. Now, let's go to the second step. Now, for the second step, before we move on to the second step, I want you to remember these values I gave you. Okay, we have other values, the carbon dioxide and the bicarbonate. These are their values. Don't forget. So put that in your mind and let's move on. So the second step is to, so now that you've decided on whether you are dealing with a case of acidosis or alkalosis, we have to go and look for the source. Are you getting the point? Where is it coming from? I earlier told you that an acidosis, too much acid, or too much base, alkalosis, can come from two sources. And the sources are one, respiratory source, or two, metabolic source. So after you have interpreted the value and you've arrived at whether the case is acidosis or alkalosis, the next thing you have to interpret is or look for is the source of these ones, what you had. Okay. Now, to do that, you have to go to the next value, the the partial pressure of carbon dioxide, and then the bicarbonate values. You have to look for the values to see which one is abnormal. To see what? Which one is abnormal. So, step two, you interpret the partial pressure of carbon dioxide. And we said the normal value is 22 to 26 millimeter of mercury, right? Good. So what do? If we are given a value, we have to what? Interpret it. So now let me teach you what happens in this scenario, in the case of carbon dioxide. I've told you earlier on that carbon dioxide is an acid. CO2 is an acid. Okay. So the more you have it, then the more you have acid in the body. Therefore, higher number of CO2 If CO2 is high, it means the patient has acidosis. Vice versa, if it is low, the patient has what? Alkalosis. Okay, now let's look at it. We said the value is 22 to 26 millimeter of mercury. So if the value that they give you, okay, number one, if the value of the um, carbon dioxide they gave you is higher than, okay, let's do the lower one. If it is lower than this lower number, 22, oh, sorry, the figure is 35, sorry, 35 to 45. I'm so sorry. 35 to 45 millimeter of mercury. Okay, I'm sure you have corrected me in your mind. Thank you. So if it is less than 35, okay, millimeter of mercury, this is here. It means that we are dealing with alkalosis. Okay, and two, if it is higher, if the value of carbon dioxide is higher than 45, then we are dealing with what? Acidosis. Okay, so you have to interpret the partial pressure of carbon dioxide for the patient. Okay, so assuming, so the first thing we did was to interpret the pH and to decide whether it's acidosis or alkalosis. Then the second step is to interpret the partial pressure of carbon dioxide, and we said the value is what? 35 to 45 millimeter of mercury. Please don't forget 35 to 45 millimeter of mercury. All right, good. So if you come here, you decide whether the value is abnormal, and if it's abnormal, is it lower or is higher? And we say carbon dioxide is an acid. It's an acid. So the more you have it, then the more acidic the person will be. So that's acidosis. Now, if you interpret it and you get the value, the meaning, then go and ask yourself again, does this agree with the pH that you interpreted first? Does it agree with it? If it agree with it, then there, then you will say that the disorder you got from interpreting the pH is likely coming from a respiratory source, because carbon dioxide comes from a respiratory origin. Are you getting the point? So assuming that when we interpreted the pH, they gave us, let's say, 7.20, as we saw in the first case, and we say this is what? Acidosis. All right, so the pH, assuming the pH they gave us was 7.20, and we interpreted it to be what? Acidosis. Then when we came to the partial pressure of carbon dioxide, I don't know why I'm missing these things, forgive me. When we came to the value they gave us in the question, we were given, let's say, partial pressure of carbon dioxide to be 51 millimeter of mercury. Now we are saying that the more, if the value is more than this, it should be acidosis. So let's interpret this. Is it more than 45? Yes. So what would this be? Acidosis. Is it the same as this one? Yes, it is. Therefore, we can conclude at this point that the acidosis happening in that patient is coming from the respiratory origin. Hence, we'll add it to the acidosis we got, and then we'll say respiratory acidosis. This will be the interpretation. Okay, so we are talking about step 2. So we are left with step 3. Now in step 3, we have to interpret the other value. Okay, so let's go to a new sheet. So let's go to a new sheet. So step 3. The step 3, we are going to interpret what? The value for the HCO3 minus, because they will give you that value also in the question. Okay. And this is the one we said the normal value is 22 to 26 milli equivalent per liter. This is the value. They are measuring the charge. Okay. It's an electrolyte. So this is the interpretation. Because it is already a base, if the value is less than 22 milli equivalent per liter, the meaning is that we will have acidosis. This one, if it is less, rather, it agrees with acidosis because it's a base. So the less we have it, the higher the acid in the body will be. 2, if it is higher than 26, then the meaning is that it is alkalosis, because that would mean that we have too much base in the system. Therefore, you have alkalosis. So, if it is within the normal value, then it's normal. I get the point. So then you come and interpret this value too and ask yourself again, does it agree with what you got in the pH? Are you getting the point? So assuming we were giving the same patient that we were giving, let's say, the HCO3 value to be 24 milli equivalent per liter. This patient's value is normal, so it will not have any effect on the pH. Therefore, the only one that is having the effect on the pH is this one, which agree with the pH interpretation of that patient. Are you getting the point? So, in effect, what I'm trying to say is that in one patient, they are going to give you the values to be what's the name? So let's talk about the patient we have been dealing with now. We said that they gave us pH of that patient to be what? 7.20. And that same patient, they gave us the partial pressure of the carbon dioxide to be, what value did I use? I think I used 51 millimeter of mercury, and we said it's acidosis. Then the partial pressure, the bicarbonate value is what? 24 milli equivalent per liter. This is the patient they gave us. So step 1, I said you must interpret. So this is the step 1. You interpret your pH. And in this pH, we said this pH is what? It means there is acidosis. Go back to the pH thing we said. If it's less than 7.35, it's acidosis. This is 7.20, so that's acidosis. Let's go to the partial pressure of carbon dioxide. It is what? 51. And we said that if that one is, so let me put the values here. This one is 7.35 to 7.45, the normal value. This one is 35 to 45 millimeter of mercury. Then this one is 22 to 26 milli equivalent per liter. Those are their normal values. Okay. So we said that if the carbon dioxide is more than 45, it's acidosis, because carbon dioxide is an acid. If you remember the beginning of the lecture, Hence, the 51 to will interpret it to be what? Acidosis. Now it's left with the step 3. So this is step 2, step 3. Let's interpret the bicarbonate. Is it within normal? Yes, it's within the normal value. Therefore, this one is normal. So it's not going to cause any effect on the pH. Therefore, the only thing that agrees with this acidosis here is the value of the carbon dioxide. And we say carbon dioxide is from the respiratory origin. Hence, this patient, the interpretation is that the patient is having respiratory what? Acidosis. I hope you've gotten it. Okay. If you have gotten that, then let's summarize. So I am telling you that when you are giving a pH, ABG value, the pH is what tells you what? It tells about the problem. Okay, and what are those problems? Either acidosis or alkalosis. All right, good. I hope you are following up to this point. It's the pH that tells you the problem. 2, you go and look for where the source is coming from. What is the source of either the acidosis or the alkalosis you've gotten? And that one, you go and interpret the partial pressure of carbon dioxide and then the bicarbonate. Now, this one is, if this one is abnormal, then it is telling you that the problem is from, that's the problem, is from respiratory origin. If it is this one that is abnormal, then the problem is what? From metabolic origin. Very, very simple. Please don't complicate anything here. Very, very, very simple. Don't complicate anything. Okay? Don't complicate anything. So, what I would like to emphasize here again is this. If you look at um, the pH behavior, okay, the relationship between the pH and the acidosis and alkalosis, acidosis is inverse. The less the pH value, the more acidic it is, and the more value, the less acidic it is, or it becomes alkalosis. Okay. Now, if you look critically, this guy, the relationship between this guy and this guy is inverse, the interpretation, because look at this. If this one is 7.20, is low, right? For this one to agree with this one rather is must be high. So a higher carbon dioxide agrees with a lower figure of what? The pH. A higher number here agrees with this one. However, the bicarbonate, if it is low, before it will agree with the pH. So for example, if the figure here is, let's say, 18, this is what can agree with. Okay, so what it means is that the pH and the bicarbonate, they move in the same order in order to agree, but the pH and the carbon dioxide move in opposite direction in order to, sorry, you are not seeing it. So this is what I said. For example, if this one is 18, it is lower than the 22, and this is what can agree with the pH for it to be acidosis. But look at this one, it has to be higher. This one has to be what? Lower to agree with the pH, which is also lower. Okay. So I'm saying that pH, when it's lower and bicarbonate is lower, then they will agree. Okay, but when pH is lower, for carbon dioxide to agree, the carbon dioxide must be higher because it's an acid. So the higher it is, then it will agree with a lower pH value, which is also acid. Have you taken note of these arrows? So a higher bicarbonate will not agree with a low pH. You understand? So basically, the pH and the bicarbonate move in the same direction to agree, but the pH and the carbon dioxide, why am I making these mistakes? Okay, the pH and the carbon dioxide move in opposite direction to agree. Okay, now based on this, I want to give you a mnemonic to remember, and that mnemonic is Rome. Rome. Okay, so the first, this has to do with this respiratory opposite, which is talking about this thing. They move in opposite direction. Respiratory has to move in opposite direction to the pH to agree. Then the last ME is metabolic, is what? Equal direction. So this is opposite direction, equal direction. Room. So the respiratory source moves, the carbon dioxide will move in opposite direction to the pH, whilst the bicarbonate, which is the metabolic, okay, they move equal direction with the pH. I hope you got that. So what it means is that based on the room, if pH goes high, if pH is high, okay, or if, okay, let's do it like this. If pH goes down, okay, if pH goes down, and partial pressure of carbon dioxide goes up, then you have what? Respiratory acidosis. I hope you got that. If pH goes down, if pH goes down and carbon dioxide goes up, what you have is respiratory acidosis. Again, if pH goes up, okay, and partial pressure of carbon dioxide goes down, okay, goes down, what you have is what? Respiratory alkalosis. Because we are saying that what? Room, okay, the respiratory problems, they move in opposite to what? The pH. That's what we said. Respiratory problems move in opposite to what? Move opposite to what? The pH. Therefore, if pH goes down and carbon dioxide goes up, you have what? Respiratory acidosis. If pH goes up and carbon dioxide goes down, okay, then we have what? Respiratory alkalosis. Then we said metabolic problems do what? They move equal to the pH. I don't know what you said. Looking at the room, this one, they move equal. Metabolic are equal, right? Therefore, what do we say? One, if pH is down and bicarbonate is also down, what will happen? We'll have what? What's your answer? Metabolic acidosis. Likewise, if pH goes up, okay, and this one also goes up, also is up, what do we have? Metabolic alkalosis. Very, very simple. Very, very simple. Again, I'm trying to let this go inside your mind very well. We said that what? The respiratory is opposite what? Direction. But metabolic, they move in what? Same direction. I hope this is not a problem to you. I hope it's not a problem. Okay, so let's recap. To interpret ABG, the first step is to do what? First step is to look at the pH at the pH and ask yourself whether it is what? Acidosis or alkalosis or is normal. Okay, so if it is below 7.35, it's equal to what? Acidosis. If it's above 7.45, interpret it as what? Alkalosis. Very, very simple. When you are done with this, so example, if we are giving example, let's say we are giving 7.72, this will be what? Yes, your answer? Yes, alkalosis. Okay, if you are giving 7 point, let's say 15, this is what? You interpret it as acidosis. Okay, very, very simple. Then step 2, you look at what? Partial pressure of carbon dioxide. Okay, and we say that what? The normal value is 7.8, sorry, the normal value is 35 to 45 millimeter of mercury. So if it is higher than 45, this is equal to what? Acidosis. If it's less than 35, this is equal to what? Alkalosis. Okay, it's as so simple as that. Okay, so we said that this guy, the CO2 is an acid. Okay, it's an acid. Therefore, if you have more, you have acidosis. Too much CO2 causes acidosis, and too little causes alkalosis. Just put that in your mind. CO2 is acid. Therefore, too much of it will cause acidosis, and too little of it will cause what? Alkalosis. Okay. So that is why patients with poor ventilation, such as patients with chronic obstructive pulmonary disease, okay, because of that, patients who have conditions such as chronic obstructive pulmonary disease or respiratory depression, are you getting the point? Will retain carbon dioxide and develop respiratory acidosis. So respiratory acidosis is associated with inadequate ventilation and accumulation of carbon dioxide. Are you getting the point? So sometimes they will give you a question that is not even giving you the values, but they will ask you how do you think the pH will go. Are you getting the point? Yes. So again, if a patient is having a condition that is hyperventilating, they will remove most of their carbon dioxide from their system, and they will have little amount of carbon dioxide, and therefore that will cause alkalosis. And that alkalosis is coming from respiratory origin, therefore respiratory alkalosis. Okay. So the third step is to look at what? The third step is to look at the bicarbonate, HCO3. Are you getting the point? And that one too, we knew that the value is 22 to 26 milli equivalent per liter. Okay. So this is the thing. This guy is a base. So more of it will cause alkaline. Okay. And less amount of it will cause acid. All right. So just know that low or this, if it's less than 22, are you getting the point? This will cause acidosis. But this acidosis is metabolic. Okay. Then higher amounts that is greater than 26 will lead to what? Alkalosis. And again, this is metabolic. So again, I'm emphasizing bicarbonate is a base. Because it is a base, low base will cause acidosis and high base will cause alkalosis. Is that okay? So example is a patient with severe diarrhea. All right, because there is bicarbonate in the small intestine, especially at the duodenal area, duodenum. A patient with diarrhea may lose the bicarbonate and develop metabolic acidosis. So that's application, clinical application. Anyone who is having diarrhea, severe diarrhea, may lose the bicarbonate. And once the patient loses the bicarbonate, then the patient develop metabolic acidosis. Okay. Then, in contrast, a patient who is having prolonged vomiting, okay, when someone is vomiting, the person is losing the gastric acid, okay, the HCl that is in the stomach, all right, and because it's losing the acid, that patient will develop what? Metabolic alkalosis. Is that okay? Good. Now, so let's get a patient. Let's get one example. Let's get one example and solve. Assuming that they give you a patient, so example one. Assuming that they give you a patient and value is this for the pH, is equal to 7.28. Then partial pressure of carbon dioxide is 55, and then HCO3 is equal to 24. What is your interpretation? So first, let's apply the rule. We'll go here first. This one. What is your interpretation? Is it below or is above? Is below. Hence, is what? Yes, you are right. Acidosis. Carbon dioxide is 55. Is it normal? So this is not normal. It's lower. So it's acidosis. This one, is it normal? You remember the normal value? So this is not normal. Is it high or low? It's high. And when carbon dioxide is high, it's also acidosis, right? So we will interpret this as acidosis. This guy, is it normal? It is normal. So which one agrees with the pH? This one. The carbon dioxide agrees with the pH. Okay. So this guy agrees with the pH. Therefore, what is the interpretation? What is the diagnosis of these patients? Hmm? Okay, you are right. It's respiratory acidosis. Congratulations. Let's see example 2. Let's see example 2. Okay, so let's say that the pH is 7.30, partial pressure of oxygen is 40, and bicarbonate is 18 millimeter of mercury, milli equivalent per liter. So here, is this normal? No, it's low. So this is what? Acidosis. This guy here, is it normal? Yes, it's normal. Okay. What about this one? Oh, sorry. You can't see. I'm so sorry. So this is not normal. It's low. So it's as the interpretation is what? Acidosis. This guy is 40. Is it normal? Yes, it's normal. So there is no problem there. What about this one? Is it normal? No, it's not normal. So how do you interpret this? Base is low. So this is also acidosis. Does it agree with the pH? Of course, it agrees. They are the same. They are moving in the same direction. Hence, this is what? Metabolic acidosis. Congratulations. Congratulations, you have gotten it. Okay. Now, the last thing I want to teach you is what we call, should we do another one? Should we do another one? Okay, let's do another one before we move to what I want to teach you. Example 3. So here we have a pH is what? 7.50. Let's say the pH is 7.50. Then partial pressure of CO2 is equal to 30. Then bicarbonate, let's say 24. So 7.50, then 24 and 30. So let's interpret the pH. What is it? Is it normal? No. Is it acidosis or alkalosis? It is alkalosis. I know you have gotten it. This guy, is it normal? The partial pressure of carbon dioxide? No, it's not normal. This is low. And if carbon dioxide is low, what will it result in? It will result in alkalosis. Okay. This guy here, is it normal? Yes, it's normal. Okay. Hence, what's your interpretation? This and this agree. So what's your interpretation? It is respiratory alkalosis. Great. Simple. Don't complicate it. Don't complicate it at all. I can see you are enjoying the example. So let's do a last example. Example 4. So let's do example 4. Then we move on to another thing. So example 4. Let's say the pH is equal to 7.48. This is equal to 40, and then it's equal to, this is 32. So first rule is to look at the pH, right, and interpret it. So let's interpret the pH. Here, is it normal? No, it's not normal. What does it signify? Is it more or less? It's more. So this is alkalosis. This guy, is it normal? Yep, it's normal. It's a normal value. This one too, is it normal value? No, it is high. So because it's high, it will be what? Alkalosis. Because higher base level is alkalosis, right? So what is your diagnosis? What is your diagnosis? Metabolic alkalosis. Correct. You've done well. Great. You have really done well up to this point. And that is very, very great. Okay. Now, let's move on to the other thing I want to teach you. That one quickly, which we call compensation. How to identify compensation. Okay. How to identify compensation. So, in compensatory processes, you will see that all the two things, or all the three, can be abnormal. They will all be abnormal, and therefore, how do you interpret that? That is what we are coming to do now. So, for example, we are going to identify compensation, what we call compensation in acid-base imbalance. So, for example, if your pH given to you is, let's say, 7.31, partial pressure of carbon dioxide is, let's say, 30, then bicarbonate is 15. Now look at the values. You can see that this value, the pH, let's interpret the pH. How will you interpret that? Is it high or low? It's low. So this is what? Acidosis. Okay. Now let's look at the carbon dioxide. Look at the carbon dioxide. It is low. It is low. It's not normal. And this should be alkalosis. So this should be causing alkalosis, right? But look at the pH. The pH is saying acidosis. It's saying a different story. And the carbon dioxide is also saying something else. Then let's come to the bicarbonate. The bicarbonate is what? It's low, right? Now the bicarbonate is low. So this one too will cause acidosis. Have you seen it? It's causing acidosis. But this one is saying alkalosis. So why is the pH saying acidosis? Now, this is entering the arena of what we call compensation. Compensation. What does this mean? What this means is that when one system causes the problem of acidosis or alkalosis, the other system is sent by the body to go and take care of it, or to go and try and solve the problem. As to whether it will solve it or not is another issue. Are you getting the point? But it's hand go, hand come. Somebody trying to help the situation. So this is what is going on in this scenario. The patient is originally having what's the name? Metabolic acidosis. Okay, so there is too much acid in the body. Now the respiratory system is trying to solve it by removing its acid from the body, and its acid is what? CO2. So this patient is likely to start breathing very fast, having hyperventilation to drive out the excess carbon dioxide in the system, with the thought that it can solve the problem. Are you getting the point? Now, you see that it has driven the carbon dioxide out, and now it's 30 millimeter of mercury. But has it solved the problem? No, it hasn't solved the problem. So this one, it is not just, so if you look at this and this, they've agreed, but you can't just say it's a metabolic acidosis simple like that, because there's a problem here. There's a problem here. So here, the actual diagnosis is called partially compensated metabolic acidosis. Is what? Partially compensated metabolic acidosis. Why are we saying partially? And why are we saying compensated? Compensated because this and this are the issue. This guy is saying there's acidosis, this guy is saying acidosis. So the problem is acidosis, but it's coming from where? This place. So it's metabolic. So it's metabolic acidosis. But then the carbon dioxide has jumped in to try to solve the problem. That is the compensation. It's trying to compensate. Let me reduce my part so that the problem can be solved. So it's compensating. But the where the partially comes in is that the pH is still wrong. It's still abnormal. So it has not been solved. So it has partially addressed the matter, but it is not addressed. So it's what? Partially compensated metabolic acidosis. So like I said, why partially? Why partially? Because the pH is still abnormal. So here is the trick. If the pH were to go into the normal, then we would have said it is what? Fully compensated. Are you getting the point? Now, in compensation interpretations, we have three things. Is either you have partially compensated ones, you have fully compensation, or there is uncompensation. Are you getting the point? So for compensation, we have three types. We have uncompensated, so uncompensated can be respiratory alkalosis, respiratory acidosis, metabolic alkalosis, metabolic acidosis. Okay, so this is number one, uncompensated. Then we have partially compensated. Then 3, we have fully compensated. These are the 3 types of compensation: uncompensated, partially compensated, and fully compensated. Okay, now in what circumstance will you say uncompensated, partially compensated, or fully uncompensated? The first example we did is an example of partially. So all the things are abnormal, therefore it is partially. So partially happens when the other system, which is not the original cause of the problem, also decide to respond. Okay, when the second system, which is not the original cause of the problem, also has responded in trying to solve the problem. However, it has not been solved because the acid is still abnormal. That situation is where we have the partially compensated problem. Now, under what circumstance do we say uncompensated? In fact, the earlier examples we saw, it's a classic example of what we can say uncompensated. So uncompensated is where the other value which has not caused the problem is still normal. It's still normal. However, the pH shouldn't be normal. Are you getting the point? If this one, the pH were the pH is not normal, in that case we have an uncompensated. So for example, this one I'm showing on the screen right now, you can see that the pH is abnormal, and then the problem is coming from the bicarbonate. But look at the carbon dioxide, it's normal. It means that it has not responded. It's not even it has not decided to even respond, right? There's no response from the carbon dioxide, yet the acid 2 is abnormal. That is what? Uncompensated. So this one, if we want to critically say this, it should have been uncompensated metabolic alkalosis. So in uncompensation, the pH is abnormal and the other system has not yet corrected it. Okay. What about the partially compensated? The partially compensated. This is what the example we just did. Here, the pH will still be abnormal. In partially, the pH will still be abnormal, but the other system is responding. So you see here, the carbon dioxide is responding, is trying to solve the problem. But has it solved it? No, because the pH is still abnormal. So because the respiratory system is responding, we say it's partially. I hope this makes sense. So compensation does not usually correct the pH. It tries to bring it back towards the normal. Okay, but it may not. So that is why we have the partially. So when you are interpreting the pH, we call something finding the partner strategy. Okay, finding the partner strategy. So look at the 3 types we are going on to. So you find the partner strategy. Okay, so when you are interpreting the ABG, the pH is looking for its partner. Okay, so if the pH is acidic, find which value is also causing the acidosis. Okay, again, if the pH is telling you it is acidic, find the what? Which value is also causing the acidosis. If the pH is alkaline, find which value is also causing the alkalosis. All right, find which value is also causing the alkalosis. Okay, So let's look at it. That is the initial examples we solve. For example, the pH being 7.28, partial pressure carbon dioxide is equal to 55, then bicarbonate is equal to 24. So this is acidosis. This is it acidosis? Yes. This is what? Normal. So what is the partner? Is here. What is he partnering with here? So this is straightforward what? Respiratory acidosis. Acidosis. Okay, that was what we're doing from the beginning. Are you getting the point? But when we came to the compensation, with the example I showed you, okay, we still look for the partner, but there was one thing that wasn't agreeing. This is the one. Are you getting the point? And I explained to you how can we say is partially compensated metabolic acidosis, right? So let's look at another example. So assuming we have an example where the pH is equal to 7.38, then this one bicarbonate carbon dioxide is 30 and bicarbonate is 18. Now, what is the interpretation here? How will you interpret this pH? It's normal. It's normal, right? Good. But the partial pressure of carbon dioxide and the bicarbonate are abnormal. Okay, they are all abnormal. This one is showing what? What should have been this? Alkalosis. Then this should have been what? Acidosis. Have you seen it? So all of them are non-normal, but the pH is normal. This means that compensation has occurred. Yes, somebody has compensated. Now, the problem here is how to know the original problem. What actually caused the problem before it was compensated? That's what we will now be looking for. Are you getting the point? So this one, you have to check to know who caused the problem before it was compensated. You have to check whether the pH is leaning towards acidosis or alkalosis. You check whether the pH that is given to you, is it leaning towards alkalosis or acidosis? Okay. Now, the middle is 7.40. This is the midpoint where you have to put it. Now, look at the pH. So a pH of 7.38 is normal, but it's leaning towards acidosis. Are you getting the point? The pH here, this one, 7.38 is normal, but is leaning more towards acidosis. Are you getting the point? Now, the bicarbonate is low, which is what? It will cause acidosis, right? So based on this, we will say that the original problem was metabolic acidosis. You understand? Because the pH is leaning towards acidosis more than alkalosis. Okay, therefore, which of these two is also causing acidosis? Is the bicarbonate. Therefore, the original causer of the one who caused the problem was this guy. Therefore, it was a metabolic acidosis. The carbon dioxide here is low because the lungs are trying to compensate for what the bicarbonate has caused. Therefore, this is a classic example of what? Fully compensated metabolic acidosis. Okay, this is an example of what? Fully compensated metabolic acidosis. All right. Okay. I hope you understood up to this point. So this one is an example of what? Fully compensated metabolic acidosis. And I've taught you, if it is fully compensated, how do you know who started the problem? We use the 7.40 and decide where is the pH leaning towards more, and does it agree with which one? The one that it agrees. So here, this example, the pH is leaning more towards what? Acidosis. Hence, the one which is acidosis here is the bicarbonate. All right, therefore it is fully compensated metabolic acidosis. Yeah, so I was teaching you about the 7.40 rule for the fully compensated ABG. Okay, so what I'm saying is that when the pH is normal but the carbon dioxide and the bicarbonate are abnormal, you must use the 7.40 rule as a guide. Are you getting the point? So in this case, if the pH is 7.35 to 7.39, then you must say that it is a compensated acidosis. Okay, but if the pH is 7.41 to 7.45, then it is a compensated alkalosis, in which case you must look for which of the component, bicarbonate and carbon dioxide, which of them agrees with that pH, the original cause of the problem. Okay. So we don't just say the pH is normal ABG. No, it's not, because if the partial pressure of carbon dioxide and bicarbonate are abnormal, something is happening, and that thing is what you must actually look for. So that is where we talk about fully compensated, partially compensated, or uncompensated. And I've told you uncompensated happens when the other component, either the bicarbonate or the carbon dioxide, is still within normal and the other one is not normal and the pH is not normal. You understand? Which is the first cases we were solving, whereby one of the sources is abnormal and the other one is normal. So for example, this one, you understand? So bicarbonate shows abnormality and we say it's alkalosis, but you see the carbon dioxide is normal and the pH is also non-normal. Therefore, this one, if you want to talk in terms of compensation, this is uncompensated metabolic alkalosis. Uncompensated metabolic alkalosis. Now, we'll end it here. Please subscribe to the channel so that anytime I post a video, you will get notification to watch. And I'm sure from now onwards, you will not get any ABG value interpretation and panic. Thank you.